Today we'll be wrapping up our 3-day series on PBM Impact. If you're just tuning in, here's a brief recap. Pharmacy benefit managers, or PBMs for short, now wield nearly limitless power and influence over the prescription drug market, owning at least 85% of the pharmaceutical industry. Their tight grip on the market has allowed them to engage in unfair pricing practices with very little oversight. They can raise the price you and your insurance company pay for medications, and instead of passing that revenue along to pharmacies, they keep it for themselves. Without having to answer to anyone, they rake in the cash off consumers' backs and hurt patients in the process. Which leaves the question, what is being done about it, and how are they not being regulated? Well, let's dive in, shall we? Wisconsin Representative Michael Schraw shares some insight.
The general public has no clue. I spoke at a Republican Lincoln Day dinner about 3 weeks ago, and I said, how many in this room? And there were 140 people. Said, how many in this room know what a PBM is? Pharmacy benefit manager. 6 hands went up.
Yet the negative impact PBMs have on the nation's healthcare system is growing daily, as more and more small pharmacies are getting smothered out of the equation. Schraw said his drive to push PBM reform legislation started about 10 years ago when his pharmacist, Ken, brought it to his attention.
I walked in one day and Ken just said, you got to sit down with me and I got to tell you what's going on. We're getting killed by these things, by these PBMs. And I'm like, what's a PBM?
Schraw said he started doing his own research and asking questions. And the more he learned, the more eye-opening it was to him. Something needed to be done.
There were a lot of powerful statements and a powerful testimony from people that had personal experiences with how the PBMs have negatively affected them. And so it's just been my mission. I knew that I would be coming again this session with another bill, and Senator Felskowski and I worked on it. And, it was really frustrating at the end not having it go anywhere.
Bill 737 had 104 co-sponsors on it out of 132 legislators. Schraw personally went to every single Democrat and Republican office in efforts to get as much bipartisan support on the bill as possible. But it never even got called to the floor to be voted upon during the last legislative session. There were 13 separate asks in the bill, and there were even efforts made to amend a single one of these asks into a separate bill pertaining to hospitals that would demand some transparency from PBMs regarding formularies, called MAC pricing language, which is a spread showing the average cost of a drug across all companies that manufacture that drug.
So we had this amendment, and we added it to another bill that the hospitals really needed. So we felt this was a bill that couldn't be killed, that wasn't going to have an issue in the Senate. The MAC language, was kind of watered down a little bit, but we still got a chunk of it in there. And I thought, this is great. The governor's office was in. They didn't like a little bit of wording, so we changed it to appease them so they would sign the bill, or sign the bill that this amendment went to. And we passed it, and it went over to the Senate and died.
There are many speculations as to why the PBM reform bill has been avoided.
The ugly part of politics is that campaigns cost a lot of money to run, and not everybody can self-finance, especially in the Assembly or the Senate.
But Schraw said there are still those willing to fight for the people and what's right.
That's where, this issue, the heart of it comes in. There's how many other states, 30 some other states, that have passed pretty significant PBM reform. The decision makers in those states have made a decision. We're going to stand up for the people.
Schraw has a plan for the next legislative session to break down this complex bill and get it passed.
It's a complicated issue.
Unless you're a pharmacist or someone who works with this every day, it can be really hard to focus on the several different things this bill highlights. Schraw plans to break it down to have a legislator for each session.
And then that way, I think the health plans and the PBMs that are against this it's going to be a lot harder for them to come in and trash 12 or 13 different legislators. They were going around lobbying in each office saying, Schraw's PBM bill is going to raise prescription drug costs. Outright lying.
Schraw said he understands lobbyists and their job is to protect their clients.
There's so much money in this game for them that and they're so powerful, and the lobbying core is so well paid.
Shaw says it's frustrating because he sees the net effect that PBMs are having on so many people, including his own family, who have fallen victim to adverse medical reactions due to wrongful practices. Shaw said he and fellow supporters will continue to bang their fists on the desk until PBM reform is accomplished.
The education process is huge, and I think this patient protector will be a game changer. It's going to be super hard for them to continue to shovel this underneath the table and to try to hide it when you've got so many different avenues bringing the light out and exposing. Light is the best disinfectant, and that's starting to happen.
That's why PatientProtector.us was created. If you or a loved one are being affected, share your stories on the online portal so they can be heard by legislators. It's time to take action. Thanks for joining me.